Ever wondered if erectile dysfunction is a myth only associated with older men? Is it just a natural part of aging? Let's debunk these common misconceptions. First off, it's important to understand that erectile dysfunction doesn't only affect older men. It may surprise some to hear that according to a study by the New England Research Institute, erectile dysfunction was prevalent in 52% of the male population, with 40% of men experiencing some degree of erectile dysfunction by the age of 40. But don't fret. A separate study by Johns Hopkins University found that only a small percentage of men in their 50s and 60s were completely unable to achieve an erection, meaning most cases can be treated. Now onto the second myth, that erectile dysfunction is solely a consequence of aging. While there is a correlation between age and the prevalence of erectile dysfunction, it's not the only factor at play. Let's dive into some of the most common factors linked to erectile dysfunction. Psychological conditions such as stress, depression, and anxiety can play a significant role in the development of erectile dysfunction, sometimes referred to as psychological impotence. Medical conditions affecting blood circulation, blood pressure, and hormone balances, including heart disease and type 2 diabetes, can also increase the risk of erectile dysfunction. Medical treatments like chemotherapy, radiation, and even surgeries can contribute to this risk as well. Obesity, too, poses a risk for erectile dysfunction. Being overweight can lead to chronic health issues and hinder blood flow, both of which can contribute to erectile dysfunction. Lastly, lifestyle choices like smoking and excessive drinking can negatively impact your overall health, including your sexual health. Smoking damages blood vessels, affecting blood circulation and your ability to achieve and maintain an erection. Overconsumption of alcohol can also diminish sex drive and prevent you from orgasming. So it's clear that erectile dysfunction isn't just an older man's problem or an inevitable outcome of aging. It can affect men of all ages and can be influenced by a variety of factors, some of which can be mitigated by leading a healthier lifestyle. A study by the Harvard School of Public Health found a correlation between lifestyle factors like alcohol intake, smoking habits, and physical activity, and erectile dysfunction. The study noted that men who exercised regularly were 30% less likely to develop erectile dysfunction than those who did not. In summary, while age can play a role in the prevalence of erectile dysfunction, it's not the only factor. Psychological and medical conditions, medical treatments, obesity, and lifestyle choices like smoking and drinking can all contribute to erectile dysfunction. However, leading a healthier lifestyle can potentially prevent or mitigate these risks. Remember, erectile dysfunction isn't a problem limited to older men or a natural part of aging. It can affect anyone, and there are ways to manage and treat it.